kidneys are real silent heroes of the human body. Every day, they work tirelessly to filter toxins, balance fluid levels, and maintain proper body function. But what few people know is that before a serious problem happens, the kidneys can send warning signals. Ignoring these signs can put your health at risk. We're going to talk about 7 important signs that your kidneys may be trying to show you. Be aware, as recognizing these symptoms in time can make all the difference. Swelling in the body, a silent warning from the kidneys. Imagine waking up in the morning, looking in the mirror, and realizing that your face is more swollen than usual. Or maybe your shoes, which have always been comfortable, will suddenly become tight at the end of the day. These often ignored signals can be a cry for help coming from your kidneys. Why does swelling occur? The kidneys have a crucial function: filtering the blood, removing toxins, salt and excess fluid from the body. When they are not functioning properly, this balance breaks down, and fluids begin to accumulate in the body's tissues, causing swelling, also known as edema. This problem happens because the kidneys, by not being able to eliminate fluids through urine efficiently, end up leaving the body overloaded. The feet, ankles and hands are the first to show visible signs, as gravity causes the accumulated fluid to shift to the extremities. Most common causes of kidney-related swelling: chronic or acute renal failure. When the kidneys lose their ability to filter properly, fluids and toxins remain in the body, resulting in visible swelling. Nephrotic syndrome, a condition in which the kidneys release essential proteins through urine. This reduces protein levels in the blood, leading to fluid buildup in the tissues. High blood pressure, hypertension. Hypertension can damage the blood vessels in the kidneys, compromising their function and resulting in fluid retention. Diabetic kidney disease. Excess blood sugar can cause damage to the kidneys over time, triggering edema as one of the first symptoms. Other factors contributing to swelling. Swelling can also be related to excess salt in the diet. Sodium in large quantities makes it difficult for the body to eliminate fluids. Dehydration. Irony? Not so much. Lack of fluids can cause the body to retain even more water as a defense mechanism. Heart or liver disease. Although they are not kidney conditions, they can overload the kidneys, intensifying the problem. How to identify if swelling is really a kidney problem? Swelling caused by kidney problems has specific features. It is usually symmetrical, affects both sides of the body such as both feet. The skin may appear taut or shiny. When pressing on the site with your finger, a mark or sinking may remain for a few seconds, depressant edema. If the swelling is accompanied by other symptoms such as foamy urine, extreme tiredness, or changes in the amount of urine, it is essential to seek medical help immediately. Why is it dangerous to ignore swelling? Edema may seem like just an aesthetic nuisance, but the reality is more serious. It indicates that the kidneys are overloaded or damaged, and fluid buildup can overload other organs such as the heart and lungs, leading to serious complications such as heart failure or pulmonary edema. What to do if you notice swelling? See a doctor. Persistent swelling should never be ignored. A nephrologist can identify the underlying cause. Reduce salt consumption. Decreasing sodium in the diet helps relieve fluid retention. Control chronic diseases. If you have diabetes or hypertension, keep them under control to protect your kidneys. Drink water in the right measure, neither excess nor lack. Proper hydration is vital for the functioning of the kidneys. Altered urine. Urine is like a window into what's going on in your body, especially with the kidneys. Changes in the appearance, frequency, or amount of urine can be one of the first signs that something is wrong. It's a warning you shouldn't ignore, as your kidneys may be trying to tell you they need urgent attention. Why does urine change when the kidneys are not doing well? The kidneys are responsible for filtering the blood and eliminating toxins, excess water, and waste through urine. When there is something wrong with them, this function is compromised, and the effects appear directly in the urine. These changes can be caused by retention of toxins and waste in the body. The kidneys cannot filter properly. Loss of protein or blood through urine, a sign of serious kidney diseases, such as nephrotic syndrome or glomerulonephritis. Most common signs of altered urine: darker or reddish color, the presence of blood in the urine, hematuria, is an alarming sign, often linked to infections, kidney stones, or even more serious kidney damage. Foamy urine. Persistent bubbles in the urine indicate the presence of protein, which can be a sign of kidney problems, such as nephrotic syndrome. Change in urinary frequency. Urinating much more or much less than usual may indicate that the kidneys are not managing to regulate the body's fluids efficiently. Strong or unusual odor. Although food or medications can influence the smell of urine, a persistent, strange odor can be indicative of a urinary tract infection or toxin buildup. Pain or burning sensation when urinating. This is a common sign of urinary tract infection, which, if left untreated, can affect the kidneys. Other conditions that can change urine. In addition to kidney problems, other factors can also influence. Dehydration. Urine more concentrated and dark yellow in color. Excess fluid consumption. It can lead to very clear urine, and in large quantities. Diets or supplements. Some foods, such as beets or vitamin supplements, can change the color of urine temporarily. Why is it dangerous to ignore these signs? Changes in urine can be the first sign of serious conditions, such as kidney failure, infections, or even chronic diseases. Ignoring these signs can allow the problem to worsen, putting not only your kidneys at risk, but also other vital organs. What to do if you notice altered urine? See a doctor immediately. Do not wait for the symptoms to go away on their own. A specialist may order urine and blood tests to identify the cause of the problem. Stay hydrated. Drinking enough water helps keep your kidneys working properly. Avoid self-medication. Some medications can overload the kidneys. Always consult a doctor before taking medicine on your own. Extreme tiredness. The body asking for help from the kidneys. The constant feeling of fatigue, even after a good night's sleep, can be more than a simple sign of exhaustion. When your kidneys are struggling, this tiredness can be one of the first symptoms. After all, the kidneys play a vital role in the body, not only filtering waste and toxins, but also regulating the production of red blood cells, essential for carrying oxygen throughout the body. When this function is compromised, the result is extreme tiredness. How do the kidneys influence our energy? The kidneys play a crucial role in producing a hormone called erythropoietin, which stimulates the bone marrow to produce red blood cells. These blood cells are responsible for transporting oxygen to the organs and tissues of the body. When the kidneys are not functioning properly, erythropoietin production decreases, leading to a reduction in the amount of red blood cells. As a consequence, your body does not receive enough oxygen, resulting in constant fatigue and a feeling of extreme tiredness. Causes of tiredness due to kidney problems. Chronic renal failure. When the kidneys begin to slowly fail, the body loses the ability to eliminate toxins and regulate fluid balance. This can lead to anemia, a condition characterized by a lack of healthy red blood cells, which causes tiredness and weakness. Diabetic kidney disease. Poorly controlled diabetes can damage the blood vessels of the kidneys, impairing their function and resulting in low oxygen levels in the tissues. This worsens the feeling of tiredness and can lead to serious complications such as kidney failure. High blood pressure. Chronic hypertension can damage the blood vessels in the kidneys, making it difficult to efficiently filter waste. This can also affect the body's ability to carry oxygen, causing constant fatigue. Electrolyte disturbances. The kidneys regulate the balance of minerals such as sodium, potassium, and calcium. When they do not work well, an imbalance can occur, which also affects the muscles and nervous system, contributing to fatigue. How to identify kidney-related fatigue? Tiredness caused by kidney problems is not the type of fatigue that improves with rest. It is persistent and intensifies over time. Some additional signs include lack of concentration. The mind also slows down due to low tissue oxygenation. Frequent headaches, also linked to decreased cerebral oxygenation. Muscle weakness. Over time, you may experience difficulty performing simple activities due to lack of energy. What can make fatigue worse? Lack of adequate treatment for chronic diseases. If you have diabetes or hypertension, inadequate control of these conditions aggravates the functioning of the kidneys and consequently fatigue. Sedentary lifestyle and poor diet. Lack of physical activity and a diet rich in sodium and sugars can also overload the kidneys, causing tiredness to intensify. Dehydration. Lack of water in the body causes the kidneys to work harder to filter waste, which can result in increased fatigue. Why not ignore fatigue? Persistent fatigue can be one of the first signs that your kidneys are malfunctioning, and ignoring it can lead to serious complications. In addition to impacting your quality of life, extreme tiredness can be a sign of kidney failure or other kidney diseases that, without proper treatment, can progress to kidney failure. What to do if you feel extreme fatigue? See a doctor. If fatigue is constant and does not improve with rest, it is important to seek medical advice. Blood and urine tests can indicate kidney function and detect possible problems. Control your chronic conditions. If you have diabetes or high blood pressure, it is essential to keep these problems under control to prevent kidney damage. Stay hydrated. Drinking enough water helps the kidneys work efficiently and prevents the overload of toxins in the body. Adopt a healthy and balanced diet. Avoid processed foods, high in sodium and sugars, which can damage the kidneys and aggravate fatigue. Extreme tiredness is not a simple sign of fatigue. When persistent, it can be a warning that your kidneys are overloaded or malfunctioning. By recognizing this symptom and acting quickly, you can avoid serious complications and improve your quality of life. Don't ignore the signals your body is sending. The health of your kidneys directly reflects on your overall well-being. Thank you for taking the time to learn more about the importance of taking care of your kidneys. Your well-being is paramount, and every step you take towards prevention and taking care of your body is a step towards a healthier and more balanced life. Keep taking care of yourself, and remember, the health of your kidneys reflects on your quality of life. Thank you for following along, and may you have a journey of health and vitality. I sincerely thank you for taking the time to learn more about this very important topic. Health is one of the greatest gifts we can have, and becoming aware of the signals our body gives us is one of the most effective ways to ensure a long and healthy life. By seeking information and taking steps to take care of yourself, you are already one step ahead in maintaining full and balanced health. I wish you a journey filled with well-being, vitality, and achievements. May you continue to make conscious decisions to take care of your health, always with an attentive eye to the signals of your body. May your kidneys, your energy, and your quality of life flourish in a positive and lasting way. Thank you so much for following, and may health always be by your side, guiding your steps towards an increasingly full and happy life.